We have the usual excellent equipment that many places have, and state-of-the-art equipment. What is unique about fetal imaging here at Children's is the perspective of the pediatric radiologist who performs the imaging, and the experience of knowing what newborns are like and children are like as they grow with the same problems that we see in the fetuses. We have wonderful technologists. They have great experience in dealing with families and with children. They have extensive experience in examining small structures and in understanding the abnormalities that we commonly see in fetuses. And they see them in children as well after they're born.
There are several techniques that we use at the AFCC to make a diagnosis in these situations. The mainstay of fetal diagnosis is with ultrasound, and that's fairly traditional. We have the capability to make 3D renderings, 2D grayscale, Doppler. These are fairly standard procedures. The second most commonly used procedure is magnetic resonance imaging, or MRI, which uses a magnetic field, not X-rays, to create anatomic images in a way that's safe for the family, for the baby and the mother. It's a technique that's fairly recently used because of advances in software and hardware. We can acquire images within subsets of time, maybe 30 seconds or so, and create pictures that can look at the entirety of the baby, that don't have the limitations of shadowing by skull, for example, that can be a problem with ultrasound. So very often we're able to give additional information above and beyond that.
For the expecting mother, a fetal echocardiogram is very similar to a regular obstetric ultrasound that they undergo. The mother is usually placed on a bed in a very quiet room. The lights are turned off, and we expose the abdomen and place gel on the abdomen. This is for the ultrasound machine. And then it's a small probe that's connected to the ultrasound machine that is used to take pictures of the fetus. The mother is made as comfortable as possible, although being pregnant and lying on your back for a prolonged period of time can be uncomfortable, so we do allow them to roll around from their left side to their right side, also to walk around if they need to. We also have food available if they're feeling dizzy or hungry or hypoglycemic, so we try and make it as comfortable experience as possible. A fetal echo provides us with continually new insights into our understanding of the fetal heart, fetal cardiology, the way cardiac defects evolve in utero, and how the developing heart works. The technology is relatively new, and the technology continues to improve, where we're able to take pictures of the heart and follow the progress of normal hearts and cardiac lesions from much earlier in gestation. Even now, as early as 10 or 12 weeks, people are doing ultrasound and looking at the heart. And so we've learned a fortune by observing these fetuses, both normal and with abnormal hearts. And it has enhanced our understanding of cardiac defects. More than 20 years ago, people saw children at birth for the first time with cardiac defects, and what was happening in utero had to be surmised from what they saw at birth. Now we're able to observe the evolution of these heart defects in utero, and really it has enhanced our understanding of how these defects have developed, and probably enhanced our ability to strategize about improved therapies for these defects.
A pediatric radiologist is suited to collaboration in a fetal care center because of their additional training in the diseases of newborns and infants. Specifically, we've spent our career learning about what is unique to this population. Some of us, having done it for 15, 20 years, that degree of experience is critical in dealing with fetuses who've stepped back just a few months. Many people naturally are worried about safety with these procedures. Ultrasound is a technique that's been performed since roughly the 70s, and certainly over time. We've been very careful to be sure to use energies that are safe for the family. And with this length of experience, there's no known ill effect. We're careful to use techniques that deposit very little energy. With regard to MRI, this is a technique that was actually started in the 1980s. So we also have fairly long experience with this as well. There have been studies that show that pregnant technologists who work in MRI have no increased incidence of problems with their pregnancy. So while we would never do such an exam without a good reason, when used judiciously, it is felt to be a safe technique. And finally, in the rare situation where we do radiographs, we have uniquely experienced technologists who are careful to use settings with our equipment that uses the smallest amount of radiation possible, and we only take 1 or 2 views, not many, and of course that decreases the radiation. So yes, the techniques are felt to be safe in experienced hands who use them judiciously.